What is thyroid and its function?
Okay, so your thyroid is a little gland. It sits in your throat, and it's got it almost looks like a bone shape. It's in your throat.
Okay.
And it's one of your major glands. What it does is it produces thyroid hormones. And why that's important is every cell in your body really needs that thyroid hormone. It helps with so many different functions. It helps balance out your hormones. It helps with your growth. I mean, it just does so many functions. And because it's in your throat, it's very sensitive to certain things. Like, for example, will pick up radiation very, very readily. So it's a delicate gland. But I want to talk a little bit about how it's on a feedback loop with other things. And so a lot of times when those people are coming in and they're like, there's something wrong with my thyroid, and it's been tested and everything's fine, and yet I still don't feel well, they know something's wrong. And sometimes things get blamed on the thyroid that's not really the thyroid's fault, too. And so there's a lot of times underlying things that really are triggering what's causing the thyroid. So when you say, what is the thyroid gland, I'm going to talk about how people know that there's a problem with that, the symptoms they might have. So some of the symptoms they might have would be, ones commonly people know are things like weight gain, because your metabolism slows down, cold hands and feet, brain fog, the brain just doesn't quite work, outer parts of the eyebrows thinning. Those are common, but then there's also muscle aches, extreme fatigue, joint problems, a lot of what would even be construed, constipation is a very common one. A lot of things that might even be construed as like fibromyalgia are also your thyroid not working very well.
Oh.
So all of it's kind of a combination. So there's so many things symptoms that show up that people are like, well, could be anything. And if my thyroid got tested and it was fine, then it must be one of those other things. So that's why I want to talk a little bit about the testing and also the other things that are involved with thyroid hormone.